Well, hi, everybody. Thank you so much for joining us for today's Facebook Live conversation. I'm so excited to be welcoming Senator Elizabeth Warren to discuss our new bill to protect maternal health during COVID-19, the Maternal Health Pandemic Response Act. Senator Warren has been a supporter of all of our work with the Black Maternal Health Caucus and the Momnibus, which she is supporting in the Senate. And we most recently were able to work together on the introduction of the Cash Refunds for Coronavirus Cancellations Act to help the many Americans struggling to receive cash refunds for canceled flights during this pandemic. She's been an excellent partner on these important pieces of legislation that will help families all across our country, and I'm so appreciative of all of her help and support. Later in our conversation, we're going to answer questions that have been submitted in advance from community members and from those joining us live. If you have any questions on maternal health, be sure to comment them below. Over to you, Senator.
Oh, thank you. Thank you, Representative. It's such an honor to work with you. I really like this, and I like what we're going to get done. You know, it's great to be talking with you today about such an important issue. I'm really looking forward to our conversation later on with folks. Right now, we are living in unprecedented times and challenging times for our communities, for our nation, and for the entire world. This coronavirus pandemic has strained the healthcare system. It has highlighted how broken and unequal it is, and it has added another layer of fear and vulnerability for pregnant people. As the federal government responds to the COVID-19 crisis, it cannot lose sight of the maternal mortality and morbidity crisis in this country. Alarmingly, the data still show that this crisis disproportionately impacts Black and Brown pregnant people. And the COVID-19 pandemic threatens to exacerbate these disparities. We must act now to protect mothers, to protect their families, and to confront this crisis head on. And that's why I am so proud to have introduced the Maternal Health Pandemic Response Act with you. You know, I love our bill and the work we're trying to do together here. This bill builds on common sense legislation to try to ensure that the federal government's response to COVID-19 centers pregnant people and confronts the systemic racism and discrimination in our healthcare system, confronts it head on. Our bill includes provisions to improve data collection. It includes research programs, surveillance programs, and it would ensure the needs of pregnant people are included in vaccine and therapeutic development for COVID-19. It also seeks to enhance public health information for pregnant people and to ensure lasting maternal health care and birthing experience improvements. So I love our bill. In addition to our bill, it is just as important to be pushing Medicaid coverage expansion to 1 year postpartum and to be pushing for policies that tackle the disproportionately negative maternal health outcomes for Black and Brown pregnant people. And that's why I am a very proud co-sponsor of the Momnibus. I love it that you were already talking about this. You have been a great leader of the Momnibus in the House, and it would make a difference in the lives of a lot of pregnant people for a long time to come. So I am with you all the way in this fight to ensure that families get the care and the support that they very much need and they very much deserve. It's so good to be here with you.
Well, I'm so pleased that we have a chance to have a conversation today. So I want to start off with the first question for you, ma'am. Massachusetts has one of our nation's best healthcare outcomes overall, but the challenges do face pregnant people and pregnant women of color in particular. And so if you could describe some of those challenges that are present in your home state.
So thank you. You know, you're absolutely right that Massachusetts does have some of the best maternal health outcomes, and we're very proud of that. The state's pregnancy-related mortality rate has historically been relatively low. in large part because Massachusetts has extremely high rates of health insurance coverage. So people have a lot of access to health care. But having said that, Massachusetts actually saw a 33% increase in maternal deaths from 2012 to 2014. So public health officials started looking into this. And here's what they found. They found that the mortality rate for pregnant Black women in Massachusetts was 1.9 times higher compared to the rate for white women. Researchers also found that more than half of the pregnancy-associated deaths had a documented mental health diagnosis, and that the majority of these diagnoses were prior to delivery. Researchers also found that 1 in 5 pregnancy-associated deaths in Massachusetts between 2005 and 2014 were related to substance abuse. And this trend paralleled the increase in opioid overdose deaths in Massachusetts during that time period as well. So in Massachusetts, public health officials are particularly focused on addressing the maternal mortality challenges that are posed at the intersection with the mental health crisis and with the opioid epidemic, particularly for women of color. I also just want to mention, since you were asking about what's happening in Massachusetts, I've been hearing a lot from constituents in Massachusetts about a number of really worrisome challenges that have been brought on by the coronavirus epidemic. The disproportionate burden of COVID-19 being borne by Black and brown communities, the variations in hospital policies on labor support and mother and baby separation. I've heard about the lack of sufficient personal protective equipment and testing availability for healthcare providers. I've heard about the increases in C-sections and forceps deliveries, and diminished access to anesthesia, and about high levels of anxiety and depression among pregnant people and among new mothers. The challenges our healthcare systems are facing in response to the COVID-19 pandemic are unprecedented, and public health is critical at this point. Pregnant people are facing a lot of confusion and uncertainty about pregnancy and delivery during the coronavirus pandemic. And that is one of the reasons that I am particularly proud that our Maternal Health Pandemic Response Act, which we introduced together, takes these challenges head on. It matters. Oh, so I got a chance to answer one. I'll pick up on this and I get to ask you a question. How about if we go in that direction now? You know, right now, we are living in unprecedented and challenging times for our country. And so I just want to start by saying the work you have done for the Black Maternal Health Caucus and to advocate for Black maternal health on the Hill has been so powerfully important, now even more so. So let me ask you, I was told I could ask you a question here. What inspired you to use your platform as a congresswoman to highlight this very important policy issue? Why did you get focused here?
Well, thank you. You know, the data that you shared from Massachusetts is so symptomatic of this issue across the country. In my state of Illinois, Black women are 6 times more likely to die as a result of a pregnancy-related complication than white women. And these disparities are outrageous. But I have a personal connection. A friend from graduate school, Dr. Shalon Irving, was a PhD level gerontologist and sociologist. And after we finished our master's program at Johns Hopkins, She went on to have a career with the United States Public Health Service Commission Corps, and she was working at the Centers for Disease Control and Prevention in Atlanta, and she had dedicated her career to ending health disparities. And when I was wrapping up my service in the Obama administration, she was getting ready to welcome her first child, a beautiful baby girl named Soleil. And 3 weeks after she gave birth, she died from complications of high blood pressure.
Oh.
Talking about a young woman, 36, had done everything right. She had high income, high education. She had health insurance coverage. She got her prenatal care, and we still lost her. And so what was once something that I just knew in an academic sense, right, that we had been taught in nursing school and something that we were supposed to look out for clinically, became really personal to me. And I knew that if I won my election, that this was something that I was going to want to work on here in Congress. And so very early on in my term in Congress, I teamed up with Dr. Alma Adams, Congresswoman Adams, and we identified this as a common area of interest. And so just happened to have given ourselves a name because this is Congress. And this is what we do. We give ourselves names at these caucuses and got started on the work. And, quite frankly, I've been so surprised that so many people have been interested in tackling this problem, because I hadn't seen it receive this level of congressional attention in the past. But I think it's a really important moment, because in 2020, in the richest nation on earth, with the most resources, for us to be leading the industrialized world in maternal mortality is something that's just unconscionable. And the solutions are right here in our midst, right? So you mentioned Medicaid expansion and the role of Medicaid in your opening comments. And that is the single best thing that we can do. But now that we're in this COVID-19 moment, I think that we have to rise to the challenge in a really important way. And so that's why I'm so excited about the Maternal Health Pandemic Response Act. So one provision in our bill would ensure that we're taking the necessary steps to ensure that to develop COVID-19 vaccines and therapeutics that are safe and effective for pregnant people and lactating people. And so why do you think that these efforts in particular are so important?
So that is a really powerful point to go to. The part of our bill that focuses on including the needs of pregnant people in vaccine development is so important, because often the race to respond to a public health emergency, the needs of vulnerable populations, particularly pregnant people, are often just not considered. The vaccines are developed for someone else. Federal government has poured billions of dollars into developing a vaccine for COVID-19. But so far, no developers have indicated any plans to include pregnant people in their clinical trials. And of course, we need to make sure that the science is right and confirm that it is safe for pregnant people before they participate in these clinical trials. But we're only able to know that participation is safe if we are committed to researching the needs of pregnant people during this crisis. So we can't just say, this is high risk, so we're going to stay out of this. The CDC's limited understanding of COVID-19 and pregnancy shows that pregnant women are more likely to be hospitalized and are at increased risk for ICU admission and the receipt of mechanical ventilation than non-pregnant women. As of last week, over 20,000 pregnant people have contracted COVID-19 and 44 have died. So this virus absolutely affects pregnant people, and we need to make sure that we're studying that, and when we're working on a vaccine development, that we're working on a vaccine development for pregnant people as well.
Thank you.
So what would you say are some of the ways in which the pandemic has affected pregnant people, birthing people, postpartum people? How would the reforms in our Mental Health Pandemic Response Act address those concerns directly?
Well, I think that, we've seen COVID-19 in pregnant people because we know that they're more at risk for severe illness. And according to the Centers for Disease Control and Prevention's own data, Black and Hispanic pregnant women appear to be disproportionately impacted by this severe form of COVID-19. And so we need this additional research to understand how COVID-19 affects pregnant women, right? When we have a novel virus like this, there's so much that we don't know, but the early data that we've been able to see tells a very chilling, very concerning story. And so we need to fully include pregnant women in our research on COVID-19 treatment and vaccine development, right? Because we spent a lot of time talking about the vaccine, but right now there's a variety of new treatments that are being tested and developed, and we need to know if it works and if it is truly safe and effective in all instances, including for pregnant people. And we know that this pandemic has exacerbated risks that have long existed before COVID-19 and continue to drive adverse health outcomes like food insecurity, transportation barriers, maternal and mental and behavioral health conditions, right? So some of these are social determinants of health. Some of these are pre-existing health conditions. But either way, we know that they pose high risk to pregnant people, and we need to make sure that we are tailoring resources and interventions to make sure that we're able to help during this really important time. And that's why this bill is so important, because it's laser focused, right, on improving the data collection. And I know that you've long spoken out about this, Senator, that it's outrageous that the Centers for Disease Control and Prevention has not fully released a data set disaggregated by race and ethnicity, that, we have to rely on open source media like the New York Times and like a lawsuit to be able to get that information. And it's not even fully fleshed out between pregnancy status and non-pregnancy status. And so this is written into our legislation. Ensures pregnant women are included in these trials, but then also funds a public service information campaign, right? Public education campaign, so that pregnant people understand these unique risks that they face. And the best research and advice that our scientists and researchers have can be communicated directly to these individuals. I think that this is a must-pass bill to be included in any COVID legislation that ends up moving. So I have another question for you.
Sure.
Okay, so in addition to the reforms that we proposed in our bill, I'm sorry. That was I'll rephrase. What other policies or reforms do you think are important to consider in addressing the maternal mortality crisis?
We got so much to talk about here. So I want to go back and say two things about what you've already said. The first one is your point about data, that we can't get information. You can't know what's happening to people by pregnancy status. You can't know what's happening to people by race and ethnicity. This is crucial because you can't fix what you can't see. And so I know I'm a total data nerd, but this is really important to stay on this. And I'm so proud to be able to fight alongside you on this. The second one is you asked me what else we need to see besides the data. I just can't underline enough the importance of expanding Medicaid coverage for 1 year postpartum. This would just make a huge difference. A significant portion of pregnancy-related deaths happen during that period, and it is imperative that we look to expand Medicaid coverage to ensure that new mothers are getting adequate health care during that time period. Something else that I think we ought to be thinking more about is how it is that we need to think about how to hold healthcare systems more accountable for protecting moms, particularly Black moms who face discrimination. So I've been thinking about using alternative payment models or bundled payments as a way to be able to do this. Rather than paying separately for each office visit or for each procedure that's performed, these new models would set one price for the entire episode of care and then hold the healthcare system accountable for the outcome. So, if health systems are able to coordinate their care and improve overall outcomes like raising survival rates, reducing complications, narrowing the mortality and morbidity gap between white women and women of color, then they should be able to earn a bonus for doing that. And if care doesn't improve, then we should look to identify, invest in, and demand more. Help them, but demand more from struggling healthcare systems. Look, the idea of bundled payments obviously isn't going to reach every one of the underlying inequities. And you've got to be really careful in how you design these systems and how you monitor these systems. You certainly don't want to create unintended consequences. But it might be one approach that we could use to incentivize better outcomes for mothers and for their babies. And frankly, I think that's the direction we've got to go in. We've got to be willing to try some new pieces. Like you said, the world has changed because you're there leading the charge. This is something Congress had not been engaged in. But now what we've got to do is we've got to say more than we want you to pay attention. We want you to try some new things. We want you to get out there and make a difference. So let me ask you, what do you think people can do to get more information about the maternal mortality and morbidity crisis in this country? And what's the best way to get involved in pushing for the changes that we have discussed today?
So people can get more information by visiting our website, the Black Maternal Health Caucus website. It's really easy to find it on Google, quite frankly. If you just said Congress Black Maternal Health Caucus, it'll come up. But it's my team will put the exact link in the chat for viewers. The other thing is you can look up information about what's going on in your state. And so the Centers for Disease Control and Prevention has some helpful information there. And we have a variety of partners that we work with across the country. We also will direct you to our Twitter account at BMH Caucus on Twitter. And we keep everybody posted every day with the latest research findings, what's going on with our stakeholder partners around the country, and obviously movement of our big bill, the Mommy Bus, and then other legislation that we're so proud of, like this Maternal Health Pandemic Response Act. I have a question from a constituent.
Oh, good.
That I wanted to pose to you. What policies and protections can be put in place in hospitals to ensure that the partner or support person can be present during and after the birth of a child, regardless of a pandemic threat level?
Okay, so that's a great question because now we're really getting down to the specifics, right? And our bill creates a task force on birthing experience and safe, respectful maternity care. And the idea is to convene researchers and doctors and nurses and certified professional midwives and doulas and patients and other stakeholders to get together and provide recommendations to improve maternal health outcomes during this COVID-19 emergency. Let's get the people who are affected, the people who are living this every day to get together and get these recommendations. And then the idea is we use these recommendations to guide policies that would ensure that moms have the support they need and that everyone's safety can be protected. We also require that task force to come up with policies that will specifically ensure respectful and anti-racist maternal health care. So let's get folks together and make that happen. What do you think, Lauren? I know you're asking me the constituent questions, but is there more that you think we should talk about here?
Well, I want to thank you so much for joining us for this incredible Facebook Live conversation. I have enjoyed our ability to partner and work together to save moms' lives in our country. So our viewers should just know I am audio delayed. So we've been trying to fake it this whole time, friends. Okay, so you asked me a question, yes?
Yeah, just if you wanted to add anything to what I said, but I'm fine. We're good.
Okay. Well, what more people can do is they can reach out to their members of Congress, ask them to co-sponsor this important legislation, whether it's the House or in the Senate. and we're trying to build support for this bill. I want to thank you for your leadership, ma'am. Thank you for your partnership. You've been such an incredible resource for us in my office, and we're so thrilled to be able to tackle these important issues for families during COVID-19 as we continue to pursue our efforts for data-driven, evidence-based policymaking. We continue to consult the evidence, and when we see disparities in the making, we're trying to tackle it head on, and I appreciate being able to work with you. Thank you for your time and for your patience with our technology, and I look forward to seeing you again.
You bet. I just want to say again, thank you for your leadership. I'm so glad we got to do this today. We were a little technologically challenged, but I thought we did a great job on this. We got through, because this is a powerfully important fight, a fight from the heart, and a fight that truly lives depend on our making some real changes. And this is what you can do. This is what it means to have a real leader. So thank you for all you're doing on this, and count me in. I'm in this fight with you all the way.
Thank you.
Bye-bye.